Hi, did you know that there's still a disease in the world that affects millions? And this same disease can go on in the body unnoticed, even for decades. This neglected tropical disease is called Chagas disease. This disease still go on affecting and impacting millions of lives silently. Welcome to another episode of Parasite of the Month with T. Chagas disease is caused by a parasite called Trypanosoma cruzi. This parasite is transmitted primarily by a blood-sucking Triatominae insect known as kissing bug. Chagas disease is one of the major neglected tropical diseases, mainly endemic to Latin America. Unlike mosquitoes that inject parasite directly into the bloodstream, kissing bugs defecate while feeding on a person. The parasite is present in their feces. When a person scratches the itchy bite, the parasite enters through the broken skin, their eyes, or even the mouth. It is a small moment, but it can lead to a lifelong infection. Inside the human host, the parasites invade the cells, especially the muscle and cardiac cells, where they transform into a mastigote. They multiply inside the cells, then they convert back into trypomastigote, bursting out of the cells and entering into the bloodstream. From there, they infect new cells and they can be taken up by another Triatominae bug during a blood meal. Trypanosoma cruzi can also be transmitted through congenital transmission, that is, from infected mother to child during pregnancy, or also through blood transfusion or organ transplantation if blood is not properly screened, or it can be transmitted through contaminated food or drink, oral transmission. Chagas disease has two major phases. The first is the acute phase, which occurs within weeks to months after infection. Many people don't even realize they're infected. Some may develop mild fever, swelling at the site of infection, or swelling around one eye. Next comes the chronic phase, when the disease becomes truly dangerous. Years, sometimes decades after infection, about 30% of patients develop serious complications. The parasite damages the heart muscle, leading to cardiomyopathy, which is weakened heart muscles, or arrhythmia, a condition where the heart beats irregularly, and also lead to heart failure and in severe cases sudden cardiac death. Others may develop digestive complications like enlarged esophagus or colon. Globally, an estimated 6 to 7 million people are infected. It remains one of the leading causes of infectious heart disease in Latin America. Diagnosis. For the acute phase, direct parasite detection can be carried out through microscopy or PCR. Serological tests like ELISA and indirect immunofluorescence must be carried out to detect the chronic phase. Two antiparasitic drugs which are currently used for treatment are benzimidazole and nifurtimox. Treatment is most effective in acute phase. In chronic phase, it may reduce disease progression but does not reverse organ damage. Prevention can be carried out through vector control, insecticide spraying of houses, also improving housing conditions, whereby reducing cracks where bugs can hide. Blood screening programs can also be done. Maternal screening during pregnancy can be carried out. And finally, food safety measures must be ensured. And that's all for today on Parasite of the Month with T. Thank you for your support. Thank you for liking, sharing, and always commenting. If you haven't subscribed, please kindly subscribe. And see you next time on another episode of Parasite of the Month with T.